The prostate gland is a small but important part of the male reproductive system, located just below the bladder and surrounding the urethra. It produces seminal fluid that nourishes and transports sperm. As men age, the prostate often undergoes changes, leading to two common conditions. BPH is a non-cancerous enlargement of the gland, mostly related to hormonal changes with aging. It mainly causes urinary symptoms because of. In contrast, prostate cancer is a malignant condition where prostate cells grow uncontrollably and may spread to other organs, especially bones and lymph nodes. Globally, both are highly prevalent in older men and often present with similar urinary complaints, making differentiation crucial. Understanding the similarities and differences between BPH and prostate cancer is essential for patients, families, and healthcare providers, because early recognition and proper treatment can dramatically improve quality of life and, in the case of cancer, survival rates. Causes and symptoms of BPH. Benign prostatic hyperplasia is one of the most common conditions in men over 50 years of age. The primary cause is believed to be hormonal imbalance associated with aging, particularly increased activity of dihydrotestosterone, DHT, a potent form of testosterone. This stimulates prostate cell growth, causing gradual enlargement of the gland. Symptoms are mostly urinary and develop slowly over time. Men may experience frequent urination, especially at night, nocturia, difficulty starting urination, weak urine stream, dribbling after urination, and the sensation of incomplete bladder emptying. In some cases, complications such as recurrent urinary tract infections, bladder stones, or even kidney damage can occur due to long-term obstruction. Unlike prostate cancer, BPH is not life-threatening and never turns malignant, but it can severely affect quality of life by disturbing sleep and daily activities. Management depends on severity. Lifestyle changes, medications like alpha blockers and 5-alpha reductase inhibitors, or surgical procedures such as TURP, transurethral resection of the prostate, are used when symptoms become very bothersome. Causes and symptoms of prostate cancer. Prostate cancer is one of the most frequently diagnosed cancers in men worldwide, particularly after the age of 60. Its development is influenced by multiple factors including genetics, family history, race, diet high in fats, obesity, and hormonal changes. At early stages, prostate cancer often mimics BPH, showing urinary symptoms such as increased frequency, weak flow, or hesitancy. However, as the disease progresses, more serious symptoms may appear, such as blood in urine or semen, erectile dysfunction, pelvic or lower back pain, and unexplained weight loss. The most alarming aspect of prostate cancer is its ability to metastasize, most commonly to bones, causing persistent pain and fractures. Diagnosis involves a combination of blood tests, prostate-specific antigen or PSA, digital rectal examination, DRE, imaging, and confirmatory biopsy. While some prostate cancers grow very slowly and remain confined for years, aggressive types can spread rapidly. Therefore, early detection is critical, and screening in high-risk men is often recommended to reduce mortality. Diagnosis and treatment differences because BPH and prostate cancer often present with overlapping urinary symptoms. Differentiating between them is essential. Diagnosis usually starts with history taking and physical examination, followed by PSA testing. In BPH, PSA may be slightly elevated due to gland enlargement, but in prostate cancer, the levels are usually much higher or progressively rising. Imaging techniques, such as ultrasound or MRI and biopsy, are definitive for detecting cancer. Treatment also differs significantly. BPH treatment focuses on relieving urinary obstruction through medication or surgery, and long-term outcomes are usually excellent. In contrast, prostate cancer treatment depends on the stage and aggressiveness of the disease. Options include active surveillance for slow-growing tumors, surgery, prostatectomy, radiation therapy, hormone therapy, chemotherapy, or a combination. While BPH treatment mainly aims to improve quality of life, prostate cancer treatment can be life-saving but also involves more risks and side effects. The conclusion in summary: both BPH and prostate cancer involve enlargement of the prostate gland, but they represent very different conditions. BPH is a benign, non-cancerous growth that causes urinary obstruction and discomfort, but is not life-threatening. Prostate cancer, on the other hand, is a malignant disease that can spread beyond the prostate and significantly impact survival if not detected early. Both conditions share common risk factors such as aging and hormonal changes, and both can present with similar urinary symptoms, which is why accurate diagnosis through PSA testing, imaging, and biopsy is crucial. Awareness among men, especially those over 50, is key to ensuring timely medical consultation. Lifestyle measures like healthy diet, regular exercise, and routine screening can play an important role in prevention and early detection. Ultimately, while BPH affects quality of life, prostate cancer affects both quality and quantity of life, making it vital for men to stay informed and proactive about prostate health.